in Indian and West Bengal economy, challenges and remedies, organized by Department of Economics, Kaliyaganj College, in collaboration with IQAC, Kaliyaganj College. Yesterday, we had three speakers. Professor Sanchari Roy Mukherjee delivered her keynote address in the inaugural session, while in technical session 1, Professor Rajita Bhorai Chaudhary explored different ways of economic rejuvenation within this pandemic situation. Professor Bibha Shaha explained post-pandemic health challenges in India. Today also we have three eminent teachers, our honorable speakers of this webinar: Professor Shoikat Sinha Roy of Jadavpur University, Professor Partha Pratim Pal, Indian Institute of Management, Calcutta, Professor Orijita Dotto of Calcutta University. I welcome all these three speakers from the Department of Economics, Kaliyaganj College. Your deliberation will enrich all the audiences present over here. Department of Economics is awfully grateful to all of you. Now, before beginning our webinar, few statutory warnings for everyone, which we have to follow basically to make this webinar clearly audible to everyone. We kindly request all of you to audience can put their question. Audience can put their question with their name, designation, and affiliation in the chat box, both in YouTube as well as in Google Meet. We will collect the questions. Speakers will respond to their queries only in the interactive session. Now, with all your good wishes, let me allow to proceed further. May I now call upon Professor Orijita Dotto to deliver her lecture. Professor Orijita Dotto from Calcutta University. Professor Dotto.
First of all, thank you very much, Chandan, for inviting me to present in this webinar. It has been I'm very happy to be a part of it. There has been number of occasions when I was also invited for some academic deliberations with the Kaliyaganj College, but somehow I missed it. So this time I'm very happy that I would be able to join.
Kaliyaganj College.
Sorry, Kaliyaganj College. So I will be I will be sharing my slides directly from my screen, laptop screen. Just 1 sec, I'm just sharing. Give me just 1 minute. Can you see my screen, Chandan? Hello? Hello?
It's visible, Orijita. It's visible.
Okay. Thank you so much, Shrikanta. Thank you. I would like to take this opportunity to just change a little bit with the title. So I am focusing within social sector, a kind of subset of the sector, and I would be talking about some pressing gender issues. Now, as we know that the development process, if it is not engendered, then it is sure to be endangered. And on the top of this, any pandemic or even a conflict affect the women very differently from men. There has been large literature on this, why this happens, that why the pandemic or even a conflict type of problems or any disaster has always have a kind of a gender bias in it, and a profound shock to our societies and economics. The COVID-19 pandemic underscores society's reliance on women, both on the front line and at home, while simultaneously exposing structural inequalities across every spheres, from health to economy, security to social protection. So what I mean to say that given the existing inequalities, existing social bias, the COVID-19 pandemic has put a kind of a pressure on the women issues, not only at home, but also uh, at the front line. And in times of crisis, when the resources are strained and institutional capacity is limited, that is when there is a kind of a resource crunch in everywhere. The women and girls actually face disproportionate impacts. And what is more unfortunate that some of the hard-fought gains for women's rights also come under serious threat. Responding to the pandemic is not just about rectifying the long-standing inequalities, but also about building a resilient world in the interest of everyone, with women at the center of recovery. So when we need to fight back COVID, we need to put the women at the center. Saying this, I would like to first talk about the women's participation in economy. And when I talk about this, I must mention that even before the pandemic, India reports to have extremely low base of female labor force participation. While this is something unusual for the developing countries, because as the development process starts, normally the labor force participation by female increase. That has happened in our neighboring countries like Bangladesh or even in Pakistan, Sri Lanka. But for India, what we find that National Sample Survey Organization, NSS, show that India's female labor force participation rates aged between 25 to 54 have stagnated at 26 to 28% in urban areas and fallen substantially from 57 to 44% in rural areas between 1987 to 2011. So, from the onset of globalization and liberalization in 1990, we find that in 20 years, the female labor force participation has not only not increased, but also in rural areas, it has found a substantial fall in the participation from 57 to 44%. Now, the explanations behind this low female labor force participation has been from the theoretical point of view, as well as from some empirical issues. Now, Feminization U Hypothesis, which was initially introduced by Sinha in 1967, and then again discussed in Goldie in 1995, where it showed that with development process, female labor force participation first declines and then rises. And the mechanisms for this initial decline is basically the rising incompatibility of work and family duties at the workplace. So when the workplace moves away from home, an income effect also happens because the husband's earnings increase, and that gives a kind of uh, not needed. The female income is not needed for the family. And what is also very important is a cultural stigma against women working outside home. And this is particularly true when an economy, where a country passes through a long phase of social unrest. And after the independence, during the British period, even before that, there was some constant social pressure on the Indian society. And because of that, this cultural stigma has been very, very high in India. So female should not be going out unless it is absolutely needed. So that is the kind of the framework on which we work. Now, the rising section emerges with a receding stigma. Rising section means the rising section of the feminization U hypothesis, when the reaching the dip when the curve again rises. So when its stigma recedes and high potential earnings of females as their education improves further, as well as the fertility decline, and better options to combine work and family duties. So now when we find that some females are getting higher education, so they actually get a lot of troubles to get their offices near their home because they cannot take care of the children. And I personally know a lot of women who have left the labor force market because they cannot balance it. So underestimation of female works, as I said, that it results, the low female labor force participation rate actually results from some, it can be explained from some theoretical as well as empirical issues. So the empirical issue behind this is the how it is underestimated, the female works. So based on primary data from a very large household survey in 7 districts of West Bengal, Ashwini Deshpande and Naila Kabir in 2019 document the fuzziness of the boundary between domestic work and unpaid economic work that leads to underestimation of women work. So when we actually estimate the female labor force participation, we consider those women who are going out. And these authors, they find that being primarily responsible for domestic chores lowered the probability of working outside after accounting for all the conventional factors. According to them, actually, being out of paid work is not synonymous with care or domestic work, as they are involved in expenditure saving activities. So when I'm taking care of my old parents, I'm actually saving the expenditure that the household might incur when if I need to hire somebody to take care of them. So it's more of expenditure saving. Even if the women who are working at home do not earn something in positive, but they are actually expenditure saving activities. We also find that religion and visible markers such as veiling are not significant determinants of probability of working. So it's not that particularly in West Bengal, the primary data from these districts, 7 districts. So it's not that the women from the minority population, they have a significantly lower probability of working. Now, the early evidence of what has happened in the post-COVID era, I would not say it's post-COVID because it's not already, we are not already into the post-COVID era. This is the COVID period that we are now in. So the early estimates of job losses by Deshpande, 2020, again, Ashwini Deshpande, found immediately after lockdown, that's in April, I guess, over 100 million men lost jobs as against 17 million women. But in percentage terms, the number of men who reported themselves as employed dropped by 29% between March and April, March 1920 and April 20, while for women, the change was far higher, 39%. So if that actually implies that even from an already low base, as I said, that women labor force participation was already low in pre-COVID period, 4 out of every 10 women who were working during the last year lost their jobs during their lockdown. So this is the early estimate that we have for the loss of jobs for women, loss of economic participation by women. Further evidence, which in India, which is based on the report by Global McKinsey Institute in 2020, which came out in July 2020, it showed that in India, women made up 20% of the workforce before COVID-19, but unemployment surveys conducted in July 2020 suggest that they actually account for 23% of the overall job losses. So you find that when women are consisting of 20% of the workforce, but the loss of jobs are 23%. So it's in higher tune, the percentage of women who are losing their jobs. At the demand side, what is happening? The men's jobs are typically considered to hold more value in the ambit of family and are therefore less likely to be foregone at this time. And in the name of safety, women withdraw from labor force more compared to men. I know personally a lot of women who have stopped going out after the lockdown was initially ended because their husbands and their family members thought that going out in this period would actually endanger their family for further infections. But from the same family, the men are still going out. So it's in the name of safety, women has withdrawn. And 50% of the respondents in South Asia believe that when jobs are scarce, men should get the job and not women. And that reflects the societal biases. And I'll just give you a snapshot from the UN Women website. So you find that the slow progress on gender parity. Gender parity, the overall gender parity score in 2015 was 0.48 and in 2019 it was 0.49. So very, very marginal increase. And within the GPS, the different components like gender equality at work, that did not change at all. Gender equality in society just changed 0.02. And legal protection and political voice changed 0.02. Physical scrutiny and security and autonomy again did not change. So on the whole, when we were seeing that there was tremendous improvement in development indicators across the economy, across the world, in terms of different issues, we unfortunately find in terms of gender parities, the indices did not improve much. And what was also important there was a kind of an issue that we find that, see, impact of COVID-19 up to 2030, the GDP, if women's role in workforce is not addressed, you will find that the GDP would increase only by, this is the GDP, estimated GDP in 2030 in dollar billion. And it would be, if we do not do anything to address these gender issues, it will be 23 billion. Whereas in kind of, if we take action, it is going to be 712. And if we wait and take action later, it will be 383. So now we also look at some gender specific sectors. because social distancing guidelines are likely to be in place longer than the lockdown. So the jobs in sectors that require close human interaction like construction, retail, and most of the informal sector would suffer more than sectors like technology and formal sectors where distancing is feasible. And women are engaged more in these informal sector, and hence they would suffer more. So distress induced in employment is hardly likely to improve the situation. What had happened in 2004-5, it would be something like that women may be forced to accept lower wages, work longer hours, or face layoffs, as there would be a desperate pool of labor who is already always willing to work at a far low wages. Now, coming to the care economy. Now, in terms of care economy, if we look that women did nearly 3 times as much of the unpaid work and domestic work as men. So we all know about this. Now, since the pandemic, a number of factors have added to women's unpaid work at home, and they include school closures and stretched healthcare systems. So this has been a driver of inequality with direct links to wage inequality, lower income, and physical and mental stresses. So what we find that with more than 1.5 billion students at home as of March 2020 due to pandemic, existing gender norms have put the increased demand for unpaid healthcare and domestic work. So the constraints of their ability to carry out their paid work, particularly when the jobs cannot be carried out remotely. So evidence from past epidemics like for Ebola epidemic particularly, that had struck Africa in 2008. So the past epidemics show that the adolescent girls are particularly of high risk of dropping out. So the care economy has putting tremendous pressure on the women itself. Now, coming to the women healthcare workers, what we find that the global health and social workers, 70% of them are women. However, out of them, those who are in the front position, who are the leaders in the global health sector, they are only 30% are women. So while they constitute of 70% of the healthcare workers, frontline healthcare workers, at the leading positions, those who have controls, only 30% are women. And the this is not exactly related to India. I did not find any related data about India, but what we find that in Spain, out of the healthcare workers who got a COVID infection, 75% were women, and the corresponding figure for Italy was 69%. So the needs of women frontline health workers must be prioritized, because here the important thing was that the masks and the other protective equipments and gears, they are designed and sized for men, leaving women at greater risk of exposure. So whatever we have, like the PPE kits, anything like this, they are all in the size of a bigger size for the men. They do not fit well for the women. This means ensuring that healthcare workers and caregivers have access to women-friendly personal protective equipment and menstrual hygiene products is very crucial. Now, I will take for India, I will give the example for the Asha workers. And who are the Asha workers? They are the accredited social healthcare workers. And in terms of Sanskrit, we know it means hope. So the Ashas are the interface between community and public health system. They are aged between 25 to 45, and they belong to the same village where they work. And Ashas are we can say they are the foot soldiers in India's battle against the dreaded COVID-19. So So what they actually do, they actually visit the households for the maternal care. But as soon as the COVID struck India, the government of India instructed these Asha workers to visit the households and gather the information about their infections, how they are, whether they have any fever, something like that. So it's the household visits that was supposed to do. And of course, that means by doing this itself, the Ashas were actually put into further danger. And if you looked at what the Ashas faced was staunch opposition from their families for their healthcare work during their pandemic. And others have encountered violence during their home-to-home service. These female health workers are India's first line of COVID-19 defense, and many ostracized by their own families, assaulted by suspected patients, and working without protective gears. So we have not forgotten those media reports where the Ashas have been attacked by the villagers, and they were abused, and there's all sorts of harassments they faced. The next group, the next issue that I'd like to focus is pandemic and women healthcare. I will not go into details because I'm sure Bivajda yesterday had talked at length about these issues. But large-scale disease outbreaks can exacerbate the lack of reproductive and sexual health services. Studies indicate that pregnancy has been a high-risk factor for increased illness and death during any pandemic. So, during the outbreak of Ebola, what we had observed was a general lack of knowledge about how the virus affects the pregnant women in Africa. And here also, the frontline health workers like the midwives struggled due to the lack of these clinical guidelines. The high maternal mortality rate due to the absence of antenatal care and lack of skilled emergency obstetric care makes COVID-19 preparedness more challenging for India. We know since the lockdown started, there was almost a closure of all healthcare services, particularly for the primary healthcare services spread across the country. And NFH's 4 data suggests that only 21% of the women across the nation had received full ANC in 2016-17 or 15-16. So you see the base is already very low, and with this pandemic, there was critical issues of further worsening of the women healthcare, maternal healthcare. And the pharmaceutical industry, the supply chains for pharmaceutical industry around the world has been disrupted. China has shut down the several drug manufacturing plants, and which had led to delays at Indian factories. So particularly the shortage of medicines occurred for contraceptives, antibiotics, to treat STDs, and the antiretroviral drugs for HIV and AIDS. So inaccessibility of these drugs in turn caused for rise in price. And there was also some black marketing occurring in the pharmaceutical industry, pharmaceutical market. Given the high technical capacity of Indian pharmaceutical companies, India is slowly adjusting to this initial shock. But the initial shock of lack of medicines availability and the supply chain issues had made it difficult to treat these women diseases. Coming to the domestic violence issues, again, the United Nations, they report that before the pandemic, there were less than 40% of the women who experienced violence reported these crimes or sought help. Since the lockdown, the domestic violence reports or calls have increased by, you see, 33% in Singapore, 30% in Cyprus, 30% in France, and 25% in Argentina. For India, I here quote the National Commission for Women data from their website. You find that these are the complaints that they received. So in total, whereas in March it was 1347, in April it initially dropped. Why this drop, we will discuss in a moment, and then it picked up. So in July it was 2,914. And similar trends of first dropping and then picking up occurred for cyber crime against women, dowry harassment cases, police apathy against women. Only for domestic violence, we have seen that since end of March, since early April, there has been a consistent rising trend. So there has been more reports of domestic violence in India as well. Now, what are the possible reasons behind this? Initially, there was restricted movement. The lockdown incapacitated the women by preventing them from moving to safer places. Handicapped mediums of communication. There was a WhatsApp number launched by the NCW, and the data that I shared here that was actually mainly taken from that WhatsApp number that NCW had floated. 38% of India owns phones and fewer have the internet connection, making this platform inaccessible to the majority of the women. The reduced contact with the natal family, this is also very important because due to lockdown, the women could not contact their natal family, and this is usually the first point of contact for the victim. Unavailability of formal support system. The machinery under the Protection of Women under Domestic Violence Act had not been identified as the essential service during the lockdown. This is actually one of the most crucial issues, that this has not been considered during the lockdown period. And hence, the protection officers were not able to visit the households. NGOs were not able to have the physical interaction, so on and so forth. So resulting in a kind of increase of domestic violence issues. Now, how about coming to the education issues? Let us first discuss the issue of education, and then later on, towards the end of my lecture, I will go to the gender issues in education. So the pandemic and school education. So what has happened during this pandemic is the prolonged closure of schools, juxtaposed with no visit to private tutors. We know that in Indian system, particularly in the two eastern states of West Bengal and Tripura, private tuition has been one of the very important support system for the school education, and that has been severely affected the learning process. Not only internet, the access to a room for study has been a real challenge for most of the households, where the students will sit and study for the entire day. And this would disproportionately affect the students belonging to the disadvantaged communities, the SC, ST, and the religious minorities, creating far wider educational divide than highlighted just by the digital divide. And this might result in increased risk of dropouts too. Now, coming to a pictorial description that World Bank has put forward, that look at these three curves. In these three curves, there is the bold line, the bold black line is the initial learning capacity curve, the ability score, right? So it follows a more or less normal distribution. And the dotted lines are the possibilities that will happen to the ability score in the post-COVID era. So case one, where we all understand that due to this pandemic, due to this closure of all the institutions, there is going to be a compromise on the ability score. This red dotted line is the minimum ability score that is needed. So when pre-COVID period, my distribution was this black line, the share of population, share of the students who belong to that part which is lower than this red dotted line was this small ash curve, gray curve. Now, when the curve shifts leftward, that the ability of the score shift leftward reduces, but the mean reduces, but the distribution remains unchanged. So this is just a shift back. So the curve below this dotted line that actually increases from here, which adds is this dark blue line. Come to the possibility, second possibility. So what happens here is from this curve, not only the mean shifts a little bit back, but also the distribution changes, and there the variance increases. So there is more inequality that creeps in, and here you will find that the share of the students who are below this curve, that actually increases fast. So this is the new area. So coming to the third option, where we have the new curve, which actually shifts not only downward, but also there is substantial dropouts. So basically, there are a lot of people who are actually come substantially below this curve. They do not learn anything. So out of these three possibilities, the Ebola pandemic in Africa had found that this is the most important possible issues. And in sub-Saharan Africa, particularly in sub-Saharan Africa after the Ebola crisis, the curve had shifted like this because of the drastic increase in the dropouts. So what we need, we should avoid flattening the learning curve in education after COVID-19. So if we need to choose from, we would definitely choose this one rather than these two. So what's the global trend that we are getting? The 2020 Global Education Monitoring Report by UNESCO in June 2020 noted that efforts to maintain learning community during the pandemic may have actually worsened the exclusion trends. During the height of the school closure in April 20, almost 91% of the students around the world were out of school. And 40% of the lower and lower middle income countries have not supported learners at risk of exclusion because of the poor linguistic minorities and learners with disabilities. And poorer countries actually opted for, some of the poorer countries opted for radio and television lessons. 55% of the poor low income countries, 73% of the lower middle income, and 93% of the upper middle income countries adopted for online learning platforms. So you can see that low income countries could use the online platform only on half of the cases. And now coming to the very crucial and much debated discussion on online mode, in India, 320, a few statistics would actually tell you how glaring the difficulties are. And in India, 320 million students have been affected by COVID-19 school closures, though the government quickly recommended shifting to online teaching, which actually ignores India's immense digital divide. And if we look at the 2017-18 NSSO report, which shows that only 23.8% of the Indian households had internet, and in rural households, where 60% of the population stay till date, only 14.9% had that access. And what is more important, that there is a gender divide. Out of them, only 16% of the women have access to mobile internet compared to the 36% of the men. And access to internet at home, this is something which is different from access to internet. Only 12.5% of the households of the students in India have internet access at home. And there is an urban-rural divide. Coming to the states like West Bengal and Bihar, is there an audio disturbance, or I'm listening to it? Hello? Hello?
Yes, there is a disturbance, Arijita.
Okay.
Is there disturbance in your part?
No, it's not.
Okay.
Okay. So in states
I'm
like...
requesting everybody to mute your microphone, please.
So
yeah, you carry on, Arijita.
Okay, thanks. In states like West Bengal and Bihar, which traditionally have large number of migrant students for colleges and universities, only 7 to 8% of the rural households have any access to internet. And why they are very important? Because they are the people who have come back, and they are the primary prospective recipients of online teaching, because they have come back, because their hostels have been evacuated and they have gone back to their home. Now, these students are indeed a more selected lot, but almost 48% of them do not have internet access at home. Please understand that those households which were able to send their children for higher studies outside the state, they are definitely better off compared to the general population, or they are at least not the vulnerable section. So even out among them, 48% of them do not have any internet access at home. And higher internet access for students who stay in hostels relative to the overall access among all university students imply that the group that in fact has the worst home internet connection are the day scholar students. That is, those who stay at their place for different institutions. And obviously, they are relatively more vulnerable. So going to the further inequalities for all special students. Now, we know that school closures also interrupted support mechanisms from which many disadvantaged learners benefit. And we talk about the blind and deaf students, those who may not avail any learning process outside the school, while children with learning disabilities or those who are in the autism spectrum may struggle with independent work in front of the computer. Now, for the poor students who depend on school for free meals and even free sanitary napkins, closures have been a major blow for them. Now, what we bring in is a new term, new jargon that is NEET, and that is not in education, employment, or training. So we find that out of 267 million young people classified as NEET, who are not into education, who are not into employment, or not into training, out of them, 2/3 are young women. They are actually doing some household chores and probably waiting for their turn to get married. So they are the most vulnerable section. And these young people as NEET, because what happens that young women and girls living in poverty with disabilities or in rural areas, they are actually pulled out of school to compensate for increased care and domestic chores. They are also more prone to child marriage. And there has been evidence from Ebola pandemic that those adolescents who actually dropped out from school initially due to closure of the schools, they never returned to the school even after the situation got normal. So they were either left for the household chores or they were married off early. So in a nutshell, COVID-19 pandemic is going to create additional severe inequalities between gender lines, losing out some hard gains in the last 20 years. I stop here, and thanks for your patient listening.
Thank you. Thank you, Orijita, for your hello.
Yes,
Yes,
I'm
thank you,
there.
Orijita.
Yes,
Okay.
thank
Thank,
you,
thank
Chandan.
you, thank you, Orijita, for your thought-provoking and um, well stimulated and enriching lecture. May I now call upon Professor Partha Pratim Pal? Are you here?
Yeah.
Professor Partha Pratim Pal?
Yeah.
Professor Partha Pratim Pal is from Indian Institute of Management, Calcutta, and he will be speaking on COVID and changing global trade. Professor Partha Pratim, now it's 3:15 or 3:16 around. You can talk up to 3:45. You can take half an hour. Okay. Thank you.
Can you see my screen?
Yes. Yes.
Yeah. So I'll be talking. Okay. So I'll be talking on international trade in the post-COVID world. What I have done here is that it is not original work by any means. I have looked at different reports which have come out from mostly WTO and some other organizations and institutions, and I'm trying to put a kind of a synthesized view from these. So when we got into this COVID world, as you know, the world was going through some trouble. It was not a very smooth sailing for the global economy when the pandemic hit. And what we saw during the pandemic is one of the worst contraction ever in international trade. If you look at the numbers, if you remember yesterday's lecture, Professor Shaha was telling that in terms of number of death or number of infected, there has been precedences that the world has seen this kind of an impact in terms of death or disease. But if you look at in terms of economic activity,
Sorry, Partha,
Yeah.
can you go for a slideshow? It's very small coming in. Can you just go for a slideshow?
is it okay?
Yeah.
Yeah. Okay. Yeah. So what I was saying is that though there has been incidents of epidemic before, and now in terms of death or number of infected, maybe there have been precedences, but in terms of impact of economic activity, in terms of the records, what we have, this is unprecedented. We have not seen this kind of a decline in recorded economic activity ever. And if you look at the numbers from a recent WTO report, which says that the global GDP, these are mostly IMF predictions, which have gone worse, in fact, over the years. The global GDP is likely to contract significantly by around between 2.5% to 8.8%, depending whether you are taking an optimistic scenario or a pessimistic scenario. And the trade volume numbers you can see on the middle column is expected to contract by 13% to 32%. This has never happened in recorded history. Though they are likely to improve in 2021, but those improvements are based on certain assumptions that we are making. And as you can see from the pandemic, from how the pandemic is operating, we are still not very clear whether our assumptions will hold true. These are assumptions which we think that gradually by the end of this year the pandemic will start easing, etc., etc. Just before going to the next slide, what the WTO Director General said is that the fall in trade we are now seeing is historically large. In fact, it would be the steepest on record. So that is the view, with the silver lining that it could have been worse if the countries not cooperated among themselves. And there is still a silver lining which I'll come later, which I'll explain towards the end of my lecture. So this chart tells you exactly how the multilateral organizations are looking at the international trade numbers. Remember, these are the merchandise trade volumes. Merchandise means trade in goods. Okay, we are not talking about trade in services here. I'll come to trade in services later. So this orange line that you can see here, orange dotted line, is this is the pre-pandemic trend. If we draw the trend from around 2011 quarter one to around 2017 quarter three, 2017 quarter three, quarter four. This is how the trade should have grown if the pandemic didn't strike. But as you can see that the first box, the red box with the green tint, during this period, trade started declining. The blue line is the actual merchandise trade volume. Remember, this is the volume, this is not the price. So we have eliminated the price effect here, and this is just the volume of trade. This is in terms of an index number that has been created. Okay, so this is the volume of trade. Now, the estimates suggest that if we have a pessimistic scenario, that means there will be a second wave of COVID, there will be not effective vaccination which will be coming out, etc., etc. Then by 2020 quarter three, we are going to see a massive decline given by the red line. Okay, gradually, then again by 2021 quarter one, there will be some kind of a recovery. With a more optimistic scenario that there is no second wave, but there is going to be a vaccine soon and the world is going to recover, the green solid line kind of gives you the trajectory of world's global merchandise trade. The green dotted line is something in between, which says that, yeah, the COVID, there will be no second wave, but the recovery will be slow because of different reasons. So even if you take all these three combinations together, the green solid line, green dotted line, and the red line, you see that the impact on world merchandise trade has been quite severe. And this is, as I told you, one of the worst in recorded history, or not in the world, not the worst in recorded history. Now, why such a massive decline? The interesting part with this COVID crisis is that it has affected the demand side, it has affected the supply side, and certain COVID-related restrictions which were not intended towards reducing economic activity is actually leading to a reduction in the volume of global production and trade both. So let us look at the demand side issues. As you know that there is going to be a global contraction of GDPs in many countries, and if you just follow our simple GDP equation, exports is basically a function of the rest of the world's GDP, imports is function of the country's GDP, our country's GDP. So if these GDPs are contracting, if these GDPs are coming down, then obviously there is likely to be a decline in the volume of trade. Also, as you know, before the pandemic start, there was also something was happening in the global economic scenario, that countries were deglobalizing. Countries were gradually shifting towards domestic economy and reducing their exposure towards the global economy, towards international trade. And there was this increase in tariff rates, increase in other restrictions, which was happening across the country. So objective of these policies were to reorient some of the demand towards domestic producers. Currency war also comes into play, because currency depreciation or managing your currencies largely means that you try to switch expenditure from foreign producers towards domestic producer. So this was already going on. What COVID did is that it affected jobs, it affected income, and it affected overall GDP of the countries, thereby bringing down the demand side, the demand which creates the markets for export. Those were brought down by a significant extent. However, that's not all. There are supply side issues as well. As you know, due to the COVID crisis, there were lockdowns in many countries. And if you lock the economy down, if you lock the market down, then there will be lack of availability of raw materials, lack of availability of workers. There will be no people who will be coming to work in your economy. So there will be a general shutdown in the production facility of the economy. And consequently, what has happened is that production got seriously hampered. Now, before the COVID struck, there were certain inventories, right? Companies keep inventories. Now, you might argue that, well, those inventories were there that could have sustained the demand for a few months, because they could have supplied those inventories. Now, that also didn't happen, because if you remember, there was a huge reduction in the global freight, global transport. Especially air cargo completely shut down during the COVID crisis. As you can see from here, there has been around 25% decline in the global cargo capacity, And also many of the maritime and land transport also was reduced, though the impact on these are not as severe. But also what happened, especially in a country like India, is that though some of the shipments arrived at the ports, from the ports it didn't reach the retail shops or the facilities where from it the last mile delivery can be done. So the some of the goods came, it got stuck in the port, and the supply side issues also came into play. So there was both demand contraction as well as major supply side disruptions. Orijita was hinting some of in one point about the supply of pharmaceuticals and drugs coming from different countries. Yes, that was severely disrupted because of all these restrictions that COVID crisis threw up. COVID-related restrictions, as I was telling you, some of the restrictions were not intended towards reduction of domestic activity or production activity or international trade, but these affected the production and supply and demand activities as well. So to contain the spread of COVID-19, many members reduced led to border closures. I mean, and introduced severe travel restrictions. And because of this severe restriction on cross-border movement, many of the trade in goods services and trade in services, in fact, was very severely affected. Here comes the role of trade in services here. And as you can see from the second and third bullet, some of the activities like sectors like tourism and education services were severely affected. In fact, within our country also, we see disruption in the education services. IIT, as you know, if you look at IITs, they have been forced to close down their hostels and send the students home. We couldn't start our offline classes, our regular classes yet, because we couldn't get the students to our hostel, to our campus. Also, the same problem happened in the cross-border trade. Indian students couldn't go to the United States. Other country students couldn't go to the foreign country where they were studying. Therefore, the entire network of activity closed down in many of the trade in services sector, tourism and education being some of the sectors which were affected very badly. Also, any hospitality industry, which is very closely linked with tourism, they also got affected pretty severely. Okay, so, and there is a drop of around 20-30% in trade in services. As we were discussing, mobility barriers also significantly affected the trade in goods through their impact on trade in services and information and transaction costs. This is something also very important to remember, that though COVID in some cases have not affected the supply in a direct manner, but it has pushed up the cost of the production, cost of supply, and cost of transport by a very significant amount, and which is resulting in a supply disruption as well. So these are some of the factors which are COVID related and which are spilling over on the economic front to create more supply related problems in international trade. As we are discussing COVID and trade in services, if you know that there are trades in services delivery happens in mode 1, 2, 3 and 4. Mode 1 is basically cross-border supply, where you sit in one country and deliver the services to another country. This type of services were not affected that much. Cross-border supply, mode 1 supply, has not been affected by COVID crisis because they do not depend on physical contact, nor do they depend on the physical infrastructure, right? So as a result, cross-border supply actually was not affected much. In fact, they received some of the business from other type of services towards cross-border supply because other modes of services could not sustain themselves. For example, mode 2, where somebody needs to come to your country to get the services, to receive the services, for example, medical services. And as the movement of people were closed, as the borders were sealed down, medical tourism came down quite severely. And some of these medical tourism services got converted to cross-border supply, where telemedicine services could have been produced. So as you can see, within the services sector, there are intersectoral mismatch or distribution that we are seeing these days. Some of the services sectors are hit very bad, for example, tourism, education, hospitality. But some of the services sector which do not depend on man-to-man contact, or it can be delivered on where over longer distance, these services are actually thriving. For example, broadband services, telecommunication services, IT services, etc. Mode, if you go by the mode of services, mode 2 and mode 4 of the services delivery were severely affected. Mode 4 is basically when somebody physically travels to another country temporarily to deliver a service. For example, if an Indian IT professional goes to United States to temporarily provide some service there, that will be mode 4. Mode 4 also has been severely affected. So trade in services behaved in a certain manner. It's not exactly like trade in goods. Trade in goods have been affected in a pretty uniform manner, apart from one sector, which I'm going to come later. But in trade in services, there are intersectoral differences. Some of the sectors were hit very hard. Some of the sectors were actually took advantage of the COVID crisis, and they have increased their activity and their business. This is also reflected if you look at the share prices of so-called FANG economy or FANG companies, Facebook, Amazon, Apple, Google, and Microsoft as well. So these companies are becoming stronger and stronger. So what is happening in this space is that there is a massive consolidation of the companies. The bigger companies are becoming bigger, they are becoming stronger, and there is a consolidation that is taking place in the service sector, which have so far managed to take advantage of the crisis. And there is an apprehension that this consolidation is likely to continue for some time now. The weaker companies will probably not be able to compete because of all these issues, and gradually they'll leave this space and the bigger companies will consolidate. So this is something which is kind of disturbing, even in the good news part of the services sector. Where the world is seeing a very different trend is on agricultural trade. Global agricultural trade during this period have actually increased. In fact, food and agricultural exports have actually increased by 2.5% during the first quarter, compared to the massive decline in the other sectors. This has largely happened because countries who are net importers of food grain are tried to buy the food grains available from the international market. And somehow the agricultural sector or the rural sector in many parts of the world has not been affected as severely by the COVID. Possibly because the population density in the rural sectors are less in most of the countries, even in a country like India, and therefore the spread of this virus have not been that much. Also, they are less connected with the rest of the world, right? So you do not see people who are going back and forth from international countries, towns to the rural economy, and therefore the contamination and contagion both have been less in many parts of the agricultural producing sectors globally, not only in India but globally. In India, we saw a reverse migration of migrant workers, and probably that may lead to a kind of a second wave of contagion in the rural sectors. But so far, the rural sector has done much better in terms of GDP, even in India. Some of the information that are coming is coming from the kind of a supporting sectors, like the motorcycle sales have gone up in the rural sectors. Tractor sales have broken all the record in rural India in the last 2-3 months, so on and so forth. So indirect evidence is suggesting that agriculture has been less affected, both in terms of production as well as international trade. International trade we see globally, agricultural exports and food exports have actually increased during the first quarter, though there is likely to be a decline in the subsequent period. But this decline is much lower than what we have seen in merchandise trade or in the negatively affected sectors of services. as far as the prices are concerned, we are kind of still on the same pattern. There is a downward trend at the beginning of 2020. The COVID-19 crisis exerted further downward pressure that is largely coming from demand decline. But once demand returns, there is a possibility that there will be kind of an increase in the food prices. There can be an increase in the food prices because the component prices, the input prices are kind of going up. This is, if you look at India's inflation numbers, you will see that in the last 9 months, though we see a massive demand shortage, the CPI inflation is hovering around 6.97%, which is above the RBI target of 4 to 6% inflation. So inflation is kind of crossing the tolerable RBI limit. Currently, there is no reason why this health crisis should turn into a food crisis. Probably that is one very good reason. However, disruptions to food supply chains will continue to be a risk for global food security. Government trade policy choices will play a major role here. And one thing that is creating some disruption is that many countries are imposing export restrictions on food grain to ensure that there is enough stock for the domestic economy. While this is providing the required stock for the countries who are net agricultural producers, for the net agricultural purchaser, net food buyers, that may create a problem if this trend continues. But so far, agricultural sector has been one of the more resilient sectors, even in the face of this COVID crisis. Now coming back, how will it affect India? One of the major changes that the world is likely to see, and as Orijita was also mentioning, is the issue of reorientation of the supply chains. Now the COVID crisis have shown that it is risky. Now, if you remember, if you just go back to before the COVID crisis and looked at the global supply chains, if you look at the Apple iPhone or any complicated product that is produced these days, it is produced across many countries, and each country provide a little bit of input to this product, and finally this product will be assembled in a country where labor is cheap. That used to be China. But over the years, Chinese wages have gone up because gradually the surplus labor that China was having is gradually drying up, and there is a upward push on the wages in China. Therefore, these countries are trying to find out places where the assembly can be done easily and cheaply. This is before COVID. Once COVID struck, it was very clear that countries were putting too many eggs in one basket and that basket is China. Therefore, they are now trying to think of alternatives. For example, this new jargon that is going on is China plus one. That indeed you don't take out everything from China, but you look towards other countries, including India, where you start testing the water, whether you can develop your supply chain based on these countries. India has an advantage because of the size and the scale. If one company wants to move out of China, it is probably okay. But if there is a big move out of China of large number of companies, many of the Southeast Asian countries, which are indeed capable countries and which are countries with very decent wages and high productivity, but they probably do not have the scale or capacity to accommodate every company that wants to move out of China. Here India comes into play, and India being a large country, and it has a good relationship, strategic, political, economic relationship with the West now, India is emerging as one of the possible destinations for this supply chain reorientation. The global supply chain has been severely disrupted. There is now a growing recognition that the developed countries were putting too much emphasis on China, and many of their companies are invested in China. China is becoming a country where people are not willing to travel that much. There is secrecy issues. We do not know what exactly is going on. There are lockdown, clampdowns, etc. So they want to diversify their supply chain and ensure that there is at least a backup if not an alternative location for their own production. And that is where India is coming into play, and India can potentially attract huge amount of foreign direct investment if if these companies find India as a suitable location. So they are just now trying to test the water. If they feel that this country is doing okay, the infrastructure is stable, ease of doing business is decent enough, and we have a stable democracy with predictable policies, then there is a possibility that India can receive some of the foreign direct investment which is looking to move out of China. And this is the whole global supply chain disruption which is happening along with the massive changes in the trade flows. So this is the second big change that COVID has introduced. It has made companies aware that an alternative location will be important. How are we reacting to this? India seems to be changing its stance vis-a-vis openness. Now, if you look at India's history from 1995, since it's joined WTO to around 2016, 2017, India has been gradually integrating its economy with the rest of the world by reducing tariff rates, removing quantitative restrictions, making trade easier, etc., etc. However, there seems to be a change. There seems to be a change in this policy. It started with that Make in India initiative, which was launched during the first government when Modi was the Prime Minister. Make in India was not exactly a policy because it was more of a thrust. It was sloganeering. It was more of a campaign by the government, but it was not backed or followed up by government measures. Okay, so it was trying to tell the companies to do a certain thing. Then there was Make in India, Make for India, etc. Those debates came in. But some amount of policy thrust was given to Make in India in 2017. We call this Make in India Part 2. During this phase, the government started increasing tariff barriers on crucial imports. They realized that if you want to do Make in India, you have to have import substitution. That means you cannot depend on imports for most of your exportables or most of your domestic production. And remember, this is the period when India's import dependence on China was increasing at a very fast rate. If you look at India's import pattern, India's imports can be main imports can be broadly divided into three categories. First is oil. Incidentally, oil also is one of the India's major export items now because there is a big factory of oil refinery of Reliance which imports crude and exports crude. So oil will figure both in India's top import items and top export items. Along with this, there is gold. India is a huge consumer of gold. And along with gold, the third most important or sometimes second most important import item over the last few years have been electronics, including computers, mobile phones, the semiconductors, etc., etc. And the kind of increase in smartphone consumption, smartphone purchase that is going on and probably forced by the COVID, this was likely to increase even more. Now, India started to take actions against this kind of huge imports, against this gold and against electronics, and large number of import duty increases took place from 2017 and every year after that during the budget. Okay, so India gradually started increasing tariff rates and tried to give some amount of actual protection to the domestic producers in making what we call Make in India Part 2. Whether this was a good idea or not a good idea, it's a different thing. I'm just stating that there was a shift in policy and there was something called effective rate of protection. They did not take that into account and it led to some problems. Now we are coming to the next phase, is the so-called Atmanirbhar phase. And this was started by the corporate tax cuts in the last year. If you remember, there was a significant reduction in the corporate taxes made by the present finance minister. Also, increased tariff and non-tariff measures are continuing. Right now, India is trying to block many of the Chinese imports by imposing standards. They are imposing these quality requirements on India's imports, and instead of using tariff rates or increasing tariff rates beyond a certain level, which we are not allowed to do because of WTO and it's something called a bound rate, India is using quality requirements to block imports. There is also a very important thrust that has happened. The government is trying to reduce export incentives to export more. The idea is that it has been a waste of money to give these exporters to export. Anyway, they cannot export, they fudge with the export data, and we are losing our money to this for this export incentive, but it is not bringing export revenues back to the country. Instead, we'll do something called product linked incentive schemes, where production which is linked with generation of employment and generation of production GDP, those will be getting incentives. So there is a thrust now of shifting incentives from exports to production. So it will be not export linked incentive, but PLI or product linked incentive or production linked incentive. There is also some encouragement to bring the supply chains home, the supply chain disruption we talked about in the last slide, that some of the companies are maybe looking for some homes in some big country, and India is one of the choices. They have many other choices, by the way. Vietnam, for example, is a very preferred choice of many of the companies. And if India do not act smart, a big amount of Chinese companies will move to Vietnam, it will move to Philippines, it will move to Indonesia. Okay. And there is also some fiscal incentives that the government is trying to give. So what, in summary, we are trying to say is that India is shifting its stance from trying to be an export-oriented country to a more inward-looking country. And if you look at these policy measures that we are seeing now, it is as if you are going back to the second plan. So the present government do not like Nehru and his legacy, but if you look at the policy measures, it is kind of like going back to self-sufficiency. We are using a different term, Atmanirbhar, but if you translate it, it will not be very different from self-sufficiency, which was introduced during the second 5-year plan, etc. And the focus also seems to be towards export pessimism and more towards domestic orientation. So these are some of the major issues that India is facing. I'll end with a slide which we were doing for a different study, that is India really ready for this? And is India really ready to tackle this pandemic? And to do that, we looked some of the health related indicators across the countries, because if you are facing a pandemic, if you want to be a global superpower in terms of supply chain and you want to draw foreign direct investment, you need to have your social sector in place, right? And these are some of the cross country comparisons of some of the health related indicators that we gathered from the UNDP site. And these are the 8-year average, 2010 to 2018 averages of physicians, nurses and midwives, and hospital beds. These are all per 10,000 people. So this will be the table for the first 3 columns will be for 10,000 people. And current health expenditure, this include both private and public health expenditure as a percentage of GDP. As you can see from here, if you just look at India's numbers and the numbers of least developed countries, developing countries, and OECD countries, for the time being, you do not look at the OECD countries. If you look at the least developed countries and the developing countries, you will see that we are, in terms of physician, we are better than least developed countries, but significantly below the developing countries, in spite of our massive human resource generation over the last 70 years or so. Nurses and midwives were kind of similar, slightly lower, but what strikes here is the number of hospital beds. We are similar to the least developed countries in terms of hospital beds and way behind either the developing countries or the developed countries. Current health expenditure also is much poor, much lower than many of the countries. As you can see, it is lower than least developed countries, developing countries, and the OECD countries. So when we talk about international trade disruption, supply chain, bringing foreign direct investment back, etc., in terms of a crisis which is essentially a health and medical emergency, which is being converted into an economic emergency or economic crisis, unless we get our house correct, unless we have measures to tackle this pandemic, probably all these economic activities will suffer if we do not get our house in order. So though there are some good signs for India, but there are some very disturbing signals that we are getting from cross-country comparison of the social sector indicators. Thank you.
Thank you, Partho. It was really illuminating, and we will take the questions in the interactive sessions. Now, Professor Shoykot Sinha Roy. Professor Shoykot Sinha Roy is actually my teacher, as well as we are from the same college. Professor Shoykot Sinha Roy will deliver his lecture on MSMEs, that is micro, small, and medium enterprises. Where is the panacea? Shoykot da.
Yes. Thank you. Thank you, Chandan, for inviting me. Now, let me try to get my presentation fixed. Let me try to get my presentation fixed, and I'll start immediately after I am able to fix it. I'm very bad at it, but let me try. Is it visible? Chandan, is this visible?
Yes.
Yes, it's visible.
Okay. Thank you. Let me thank the organizers at Kaliyaganj College, where I have been to along with Partho some years back. Uh, and I come at the fag end of the today international webinar. I'm sorry that I was not able to attend it yesterday because the online classes at Jadavpur University, the pending classes of the last semester at Jadavpur University has started this week, so I could not attend it yesterday. Now, I'm sure there will be interesting discussions that had taken place yesterday. Especially, I have heard Ajita Buddha, I have heard Sanchari, but I haven't heard Vibhashda for a long time, and I'm sure that I missed his presentation. Now, today what I'm going to speak on is MSMEs, micro, small, medium enterprises. Where's the panacea? Now, when Chandan approached me for this, I thought that it will be better for me to, if I present on MSMEs, because currently along with some of my acquaintances, one of my students, Suraj Das, and my former friend, my former colleague, Aniruddha Bagchi, we are working on some papers relating to MSMEs, and I thought I will tie the cow to the COVID tree and try to present something to you. Now, I'm really thankful to the IQAC, Kaliyaganj College, and the Department of Economics, Kaliyaganj College, and also the principal for inviting me to this important international webinar. Now, when I start presenting thing, let me lay the background with what has been happening to India's growth in the recent period. That would lay the background. And if you see that, if you if you look at India's recent growth, the annual recent growth for the period 2012 onwards, actually, I should have done it for a longer period of time, but I think that this will try to give the point why I am doing this. India is on a path of slowdown since 2010, and there was marginal recovery from 2012 onwards till 2001, till 2016, 17, and from 16-17, the annual GDP growth in real terms, it has been on a secular decline. If you go to a more nuanced, presentation, if you look at India's quarterly growth, you would see that India's quarterly growth was, though fluctuating, it increased, it peaked in the second quarter of 2016-17, and something happened in the third quarter of 2016-17, we all know, and then there was a very sharp decline, followed by a marginal recovery, and then from 2017, fourth quarter of 17-18, there was a significant decline. Now, I have purposefully kept it till the fourth quarter of 1920. In the last quarter of 1920, India was struck by the pandemic, the COVID-19. Now, so prior to the COVID struck us, India was already on a growth slowdown, and the growth slowdown was especially observed in case of manufacturing and some bit in case of services. Now, if you divide the enterprises that are prevalent in India, depending on their employment type and the enterprise type, you can have this four-quadrant diagram where you have formal, organized, you have unorganized, formal, organized, informal, and unorganized, informal. Of the four quadrants, actually the informal, unorganized, or unorganized, informal, the fourth quadrant will be, this quadrant will be the worst, because it includes all types of casual work, work for daily, weekly, and monthly wages, and self-employment with no benefits or social security in enterprises employing less than 10 workers. And if there is any crisis, this segment of the economy will be the worst affected. Now, in the light of this, let me start with the MSME sector. Like Partho said, that it's we are going back to the mid-50s. Actually, in mid-50s, the MSME sector got prominence. The sector was formalized, and associate policy changes were brought in. That means a definition of the small-scale industries were laid down, and the policy changes were done through reservation of products, establishment of industrial estates, and provision of direct subsidies to these enterprises. And this policy went up to 1991, or till the second half of the 80s, when the policy of de-reservation for the small-scale industry started. And if you look at the de-reservation pattern, you would see that items that were reserved for the MSME sector more or less remained same. It varied between 799 in 2001 and it was 821 in 88-89. Increasing number of items went to the open general license system. And by 2001 and 2, there was not a single item that was in the reserve list. So initially, there was a large number of items. In 1998-99, when de-reservation started for the sector, 43 items were taken out. And then there was increasing number of items that were taken out 343, then 236, and then 169. And by 2000, remaining items were there. And by 2001 and 2, there was not a single item in the reservation list. The name of the small scale industries sector was rechristened to MSME by 2002, as and when all the items were de-reserved, and everything was brought under the OGL. Following that, there was a new MSME Act in 2006. By the way, in 2002, when the name was rechristened, it included one more sector, which is the micro sector. So the new act actually is called the MSME Development Act 2006, which tried to do ease of registration process of MSMEs, Udyog Aadhaar Memorandum, framework for revival and rehabilitation of MSMEs, creation of MSME data bank, provision of direct benefit transfer, and so on and so forth. This all targeted towards ease of some kind of doing business for the MSME. How important is the MSME sector in India? The MSME sector in India contributes about 30% of GDP in 2016-17, with around 634 lakh enterprises in 2015-16. Activities are divided across three sectors, primarily manufacturing, services, and other trading activities. The sector employs around 111 million workers in 2015-16. About 99% of these enterprises are, however, in the micro subsector, that is 630.5 lakh enterprises out of 634 lakh enterprises are in the micro sector, and the remainder is divided into the small and the medium. Medium is even below 0.1%. So the MSME sector, it's an ensemble, if I can call it, a 3-star hotel in a city, a micro, to give you some example, a micro entrepreneur vending vegetable in a small town, a beauty parlor, a cotton ginning plant, and a tier 2 automobile supplier all get covered under the MSME sector. In the broad umbrella of the MSME sector, you have all these, and so you can understand that the sector by itself, even if we say that it's MSME, but it's a largely heterogeneous sector. And imagine that 99% of these enterprises are in the multiple segmentations. When looked at from the perspective of manufacturing and services, also bring about the diversity across the spectrum and their multidimensional intricacies. The micro, the largest segment within MSME, is itself multi-segment. Apart from this heterogeneity, there is, if you look at the spatial distribution of MSMEs across the country, in India, spatial distribution is highly skewed. Top 5 states account for almost 50% of the MSMEs, the top being UP with 90 lakh enterprises, the second being West Bengal, immediately after that with 89 lakh enterprises. Now, these top two account for almost 30%, that is 29 point something, followed by Tamil Nadu another 8%, Maharashtra another 8%, and Karnataka 5 to 6%. So distress, when you talk about distress of this sector, you have to talk about you have to take into consideration the spread of the sector across segments, the spread of the sector across states in India. when you talk about distress, the distress of this sector actually started with the sharp slowdown in the third quarter of 2016-17. I'm just stating this fact, but the details most of us here are know about it. Now, what is the employment pattern in the Indian economy? If you look at the employment pattern in the Indian economy, you would see about 52% of employment, it's from the self-employed sector, own account workers, employers, unpaid family workers. Regular salaried workers are just 23.8%. Out of that, regular informal, which is a very large proportion, which is 14.13%, and then there are casual workers. So almost around 80%, 80 to 90% of the workers, they are in the self-employed category, in regular informal category, and in the casual worker category. Most of these workers, a large section of these workers are employed. Why I highlight this? Because a large section of these workers are in the MSME sector. Now, the figure that I quote you is MSMEs account for 21% of total employment in 2018. That's that I just told you. Now, in manufacturing, first, because of dispersal of production from larger to smaller units, and second, because of creation of an informal workforce subject to fewer regulations, the fact that employing contract or informal workers reduces the bargaining power of regular and formal workers, and thereby depresses or suppresses overall wages. So this characterizes the pattern of employment primarily in the informal sector, and a large part of the MSMEs actually come under the employment in the MSMEs is under the informal sector. Informalization of industrial labor, as manufacturers seek to improve their competitiveness by paying lower wages to informal workers and making savings by foregoing expenditure on workers' benefit. On top of that, if you look at employment, my own study with my student Suparna shows that there is among workers, there is lack of industrial mobility, there is occupational persistence, and with time there has been large job polarization. Despite all trade growth since 2000, we have precisely looked from 2000 onwards, and 2000 onwards till 2015, 16, 17, the entire industrial employment or services employment, it is characterized by lack of industrial mobility, occupational persistence, and job polarization. So given this, that you have a large informal workforce in the predominant MSME sector, where there is lack of industrial mobility and occupational persistence and job polarization, when any crisis hits, it is difficult for workers to go away elsewhere and find alternate employment. Now, the lockdown in India started on March 25th, 2020. What is the predicament? What is the predicament? Pre-COVID-19 situation, which we saw that there was a decline. 19 situation was a demand-constrained economy. Lower growth during pre-COVID is on account of deficient demand, mostly from within the economy. Though often the finance minister and the government of India tried to say that this lack of demand was not from within the economy, the lack of demand was mostly from the external sector. Following the spread of the pandemic and associated lockdown, artificially generated supply bottlenecks are created on top of the existing demand constraint. Patro and Orijita both said about the supply constraint, the disruption of the supply chain, and I also abide by that. And this, so your economy gets characterized from as a, there is a demand constraint. On top of that, there is a supply constraint or supply restriction that is happening in the economy. So an excess supply situation got transformed into a situation of unmet demand. The characterization of the economy like this is done by Dipankar Dasgupta and Meenakshi Rajiv in an important article, recent important article in EPW, and I borrow their characterization. In this situation, output and employment are expected to decline further than in a typical Keynesian demand constraint equilibrium. So, post-COVID situation, output is expected to decline. So as a result, output started declining from April 20, further started declining April 2020. There is a typo. I'm sorry for that, leading indicator like credit disbursement, especially to the non-farm MSMEs, showed negative growth since April 20. And if you look at the figure that this is taken from the Reserve Bank of India, it again shows varying magnitude of distress. You would see that for large sector, there has been credit growth, more credit growth in April 2020 as over April 2019. But for small and micro and the medium enterprises, the decline, there has been a significant decline in credit disbursement to these sectors. So what does this would mean? This would mean, as UNESCAP and SANEM, they have simulated through a CGE modeling, there can be job loss to the tune of 112.8 million in April. But CMI later on actually has given a much larger figure. ILO has given a much larger figure. Now, as a result, a recent study by Bertrand, Krishnan, and Schofield, based on the CMI data, find that 84% of households have reported a decline in their income since the lockdown. What is more, only 66% of the households reported having the resources to go on for more than another week facing this distress. So there is supply constraint, there is lack of generation of income, and that further accentuated the demand problem. So demand and supply constraints riding on back of one another. In this backdrop, it is not surprising that ILO estimates that in India, about 400 million workers in the informal economy are at the risk of falling prey into poverty. World Bank estimates that around 12 million people will slip into extreme poverty with less than $1.9 a day. The latest ILO estimates show that working hour losses have worsened during the first half of the 2020. This is globally, reflecting the deteriorating situation in recent weeks, especially in developing countries. As a result, we saw there is significant emergence of problem of migrant workers who are trying to go back to their places of origin, and these migrant workers were largely employed in micro, small, and medium enterprises, and all these point to lack of demand in the economy and the importance of lack of demand in the economy, in addition to the supply constraints which were temporary in nature. Now, given this predicament, what measures need to be taken? Large-scale public expenditure reduction in transaction cost, like the one Kerala government has done. Many others have been saying about this. to reduce uncertainty in income flows. How will you reduce that? By cash transfers, but not only income, the propensity to consume can also fall in the short run, and that would create a multiplier effect in the economy in the short run. What is the way out? Liquidity can be enhanced, and if it is targeted to the poor and informal workers, mostly in the MSME sector, through cash transfer, this will arrest the decline in propensity to consume, and this calls for large-scale cash transfers program. There can be monetary policy. The Reserve Bank has been following monetary policy. Monetary policy can be conventional and unconventional. Just to mention one kind of unconventional monetary policy one can think of is actually monetizing the large foreign exchange, large and growing foreign exchange reserves. Whether that is right or wrong approach is a matter of debate. I don't want to get into that. Then there will be supply side changes, production factors like labor, which is unlikely to go back to its place of work, and there will be such unemployment due to a large surge cost for both labor and employer. Raw material supply, and Orijita and Partho both talked about the China factor, and then there will be consumer and business confidence. So to revive the economy, a recent paper by Addison, Sen, and Tarp, they show the first, all these things affect macroeconomic stability and growth. Second, the tools of macroeconomic policy, fiscal and monetary policy, together with debt management and exchange rate policy, must deal with the economic shock. Simultaneously, policymakers must find space to fund health, social protection, and livelihood support. The task of economic policy, this is very important, is to keep people alive, which Partho almost ended with, and Orijita had said. Enterprises afloat, micro, small and medium enterprises afloat, and households out of poverty. For MSMEs, there will be a varying magnitude of distress. The perspective of varying magnitude of distress across segments, as also varying degrees of credit intermediation across different kinds of lenders catering to the sector at large. Who are the lenders? They can do, and we understand that job of the policymaker is not easy at all given the diversity of the sector, and calls for a well-programmed delivery outreach plan. While policy measures are being targeted to arrest the immediate problems of MSMEs, the immediate reaction is, of course, extending the survival support by pumping in the much needed short-term liquidity through institutional and banking channels. But this does not reduce the importance of cash transfers that most of the MSMEs would have liked to got. Then what are the priorities for the government? And there is a large Atmanirbhar Bharat proposal in 5 tranches, 20 lakh crore Indian rupees, amounting to 10% of GDP. Apart from many other things, in this Atmanirbhar Bharat proposals, the share of relief or stimulus was rather less, and most of it was actually towards long-term rejuvenation of the economy. Now, there were proposals for the MSMEs, and the proposals for the MSMEs amount to rupees 3 lakh crores. Let me tell you a little in more detail about the MSME package. There were 3 lakh crore collateral-free loan, which is now extended up to November. Then there is rupees 20,000 crore subordinate debt. Then there is equity infusion to the tune of 50,000 crores to the MSME sector. And the government also notifies that all enterprises are required to register online and obtain Udyam registration certificate. All lenders therefore obtain, so the conditionalities start coming, Udyam registration certificate from the entrepreneurs. So this is apart from collaterals, though there are collateral free loans, there is the requirement of Udyam registration, and this would talk about digitization in the MSME sector. Again, in the Atmanirbhar Bharat proposals, there is a move towards domestic orientation, as Partho was saying, and global tenders were disallowed to a significant extent. However, so that the MSMEs do not become cash trap, Nirmala Sitharaman said that MSME dues will be cleared within 45 days. As far as I know from various surveys that have been carried out in the country, across various states in the country, not much has been done in this respect. There has not been any clearing of MSME dues from the government and the central public sector. The most important for the MSME is the revision of definition. And this actually takes you to the reform proposals that are proposed by the government in the MSME sector. What are the reform proposals? The reform proposals would say the new classification of the MSMEs, a micro enterprise, whether they're in manufacturing or in services, where the investment plan in machinery and equipment does not exceed 1 crore rupees and turnover does not exceed 5 crore. Small, where the investment in plant and machinery does not exceed 10 crore and turnover does not exceed 50 crore. And medium enterprises, where investment in plant and machinery does not exceed 50 crore and turnover does not exceed 250 crores. Moreover, it is a composite criterion. It's not only determined by investment, it's either investment in plant and machinery or in turnover. So if an enterprise crosses the ceiling limit specified for its present category in either of the two criteria of investment or turnover, it will cease to exist in that category and be placed in the next higher category, but no enterprises shall be placed in the lower category unless it goes below the ceiling limits specified in the present category. Now, this is a significant jump. Redefining the enterprises is a significant jump for all the thing, and you would see that now it's the same definition for the manufacturing and the services sector under the new classification. Earlier it was not, though the capital requirements are much lower in case of a service sector, whereas the capital requirement might be larger in case of the manufacturing sector. Now, from this, will this MSME package, along with the others, deliver? Now, along with this direct MSME package, which the Atmanirbhar Bharat proposals said, the Reserve Bank of India actually did a significant job by lowering the repo rate and the reverse repo rate, so that there has been more capital infusion by the banks to the rest of the economy. This Atmanirbhar Bharat proposals were announced in early to middle May, almost after 2 months of the lockdown that had started. And then the moment the Atmanirbhar Bharat proposals were there, we found that in June, there has been, if you look at the IHS market India manufacturing PMI, it increased in June from the previous month, from that in April, and the increase was significant. Even for services, there was an improvement, and the improvement was significant. The government was quick, and in its macroeconomic update, immediately the government claimed that there are the green shoots in the economy are visible. Where are these green shoots now? What has happened to them? The RBI governor also was quick to supplement, or was there with the government. He said major reforms, leverage from IT communications and power sector growth, longer term financial stability, these are essential for business, private investment, and consumer confidence. You would see that in all these proposals, there is no mention of whatsoever about government's fiscal support. However, despite the government having said the green shoots, one of the leading indicators for industrial revival, especially in MSMEs, bears testimony to the continuation of the slowdown. And which is this leading indicator? Again, the credit disbursement. And the credit disbursement in June, the July figures haven't come. You would see that the decline in the disbursement. Now, the confidence in the economy plummeted, and again there was a quick revision of the PMI, and in July, actually, the PMI has been found to decline. So there is a PMI for manufacturing as well as a PMI for services. Now, actually, what has happened? What has happened that this, if you say that there has been green shoots, I don't find any green shoots. At best, the economy is in a state of dilemma, and the supply side has not resumed fully. And even if the supply side has resumed fully, there is significant lack of demand in the economy, and the MSME sector, especially manufacturing, and within manufacturing, the MSME, which is our services MSME, which is a large proportion of the non-food sector, that actually is not showing any significant and consistent recovery. So why, despite this huge package, why this has happened? The package does not necessarily identify to which sector, subsector within MSME the credit should grow. So there is an identity crisis which needs to be addressed, and there has to be unique established identity for establishment. Too much dependency on the banking channel, as well as these are all credit backed. Most of your support are credit backed. Our major chunk of MSMEs are outside the banking channel. They are not financially included. Then the other thing, even if they go to the banks for loans, the banks would prefer, from the bank side, banks would prefer to disburse a large loan to one single large sector than to small MSMEs and many small loans to the MSMEs. So on the part of the banks, there is some kind of resilience, and they don't want to lend it to the MSMEs. Now, the MSME package does not infuse grants to support the losses and expenditure during the lockdown, and the expenditure would mean expenditure for wages if any MSMEs have paid out wages to its worker, and to cover the fixed costs. Plethora of schemes are there for the MSMEs with overlapping objectives, and small and allocations need to be rationalized. There needs to be some kind of hand-holding by the government for this large employment-intensive sector. So the package which the government has announced, actually, if you look at information, in Tamil Nadu, for one, I know that only 50% of the MSMEs have gone and taken loans. This is a picture in many other parts of the country, and in Tamil Nadu, unlike in West Bengal, actually you would find that there are larger number of medium enterprises, but in West Bengal there are a larger number of micro and small enterprises. So even the medium enterprises are reluctant to go to the banks for loans because of lack of demand. A few years back, RBI had brought in the subject of wholesale financiers, the reformed avatars of development finance institutions, more from the point of view of long-term infrastructure funding. In the recent past in India, the appeal of DFIs has been growing because the MSMEs want, and this has been mainly driven by the stress in the banking sector. The banking sector has not been able to lend, as well as the NBFC sector. Given the current predicament, should we now be reflecting on a much more enhanced role of development finance institutions in financing MSMEs? The existing ecosystem may need to quickly develop and introduce new market enabling instruments. I don't want to go out of the market mechanism, like credit enhancement products, or tweak the existing credit guarantee products to supplement effort of the commercial banks in the short to medium run. And this would do enough hand-holding. In the longer run, the government may have to come up with a new set of frameworks, alternate channels of financing other than the banking channel. So efforts should be made to ensure better credit dispensation for various segments of the MSMEs, and keeping in mind the heterogeneity of the sector, and correct market failure without requiring to finance the MSMEs entirely through public funds. So public funds are there which can be given in the immediate short term to tide over the situation, but over the medium term, what the government should do, actually do certain kinds of hand-holding, and then in the longer run, there should be channels of funding. So, and this will be divided between micro, small, and medium enterprises. The biggest challenge in realizing the objective of credit disbursement, I don't want to get out of the government mode of credit disbursement through banks. I'm providing a critique to that. Disbursement to the MSMEs will come from governance issue. The onus is on the government to support the DFIs with enabling regulations and concessional funds, because the importance of DFIs, development finance institutions, have gone down significantly over the period of time. Now, apart from this, what is the way out of for MSMEs? Because the definition, redefinition has not started working yet. The credit disbursement channel has not started working yet. Government is harping on another channel, which is digitization. Digitization is need of the hour. With Industry 4.0, most of the enterprises have to digitize, otherwise they don't survive the test of time. There is a study, Asia Pacific study on digitalization of small and medium businesses, and that predicts that US dollar 216 billion will be contributed to India's GDP by 2024 through digitization. So there is immense scope for digitization, and the government is also trying to digitize. It is noteworthy in this context that 90% of the MSMEs do not use computers. as per the 73rd round of the NSS survey. For the MSMEs in the services sector, 13% of the enterprise used computers, whereas the others did not use computers in the last 365 days. For MSMEs in the manufacturing sector, 97% of the manufacturing enterprise did not use computers in the last 365 days. That means of 2015-17. The number might have increased in today, but not very significantly. A total of 91.5% of the firms did not use internet as per
Hello.
সৈকতদার বোধহয় কিছু সমস্যা হয়েছে। সৈকতদা তো লিভ করলো, জয়েন করে যাবে আশা করি।
Chandan, would you ask him? একটু জিজ্ঞাসা করে নেবেন।
সৈকতদা উইল কাম ব্যাক সুন। সৈকতদা আসলে বলে যাচ্ছিল, সৈকতদা যে বেরিয়ে গেছে সৈকতদা বুঝতে পারেনি। সৈকতদা আসছে, সৈকতদা আবার একটু জয়েন করবে।
ওকে।
Am I visible and audible?
Yeah. Welcome back. Welcome back.
Sorry, I'm really sorry. Ah,
Ah,
uh,
okay.
just a minute, just a minute,
Yeah, please continue.
just a minute. I just want to have to share the screen where the screen is gone. Just a minute. Oh, no. I'm unable to share my screen now. I don't know why. Okay, I'm towards the end, so I will do without the. Um, it has come. Sorry, it has come. Yes. Is it visible now? Is the screen visible?
Yes, Shrikanta, yes.
Okay.
Yeah, visible.
I was talking about the digitization in the states, and if you what I was showing that in India the digitization rate of digitization is low; it's close to one. And in the states, if you look at the states, our state of West Bengal ranks 30th rank in among 31 states. So, and this is predominantly because West Bengal is full of or predominant with the micro enterprises. The micro enterprises and the small enterprises, they are reluctant digitize. They don't have the resources to digitize, they don't have the technical capability to digitize, and many other factors. They don't have the skill to digitize, to use the e-platform. So there are various constraints to digitization in India. These include the age of firms, and in India, and especially in West Bengal, most of the small, micro and small enterprises are less than 10 years. Heterogeneity of enterprises, that it is micro enterprise or small enterprise or medium enterprise, lack of skill labor to total labor, social group of entrepreneurs, whether they're from the backward caste, and labor productivity. Thus, even if supply side restrictions are removed through credit disbursement and digitization or digitalization, and transport resumption and freer movement of people are allowed, the question is whether labor will go back to work and whether the MSMEs will start working in full bloom again. They might not have the working capital and the MSMEs, most of the surveys will show the MSMEs are reluctant to borrow from the bank, even they are given a moratorium of repayment, are reluctant to borrow from the bank and meet their fixed costs or losses they have incurred during the period of lockdown or the 3 phases of unlockdown. The recovery in the economy, especially in the MSMEs, is unlikely unless there is revival of demand in the economy that would generate certain kind of through cash transfers in major programs like the MNNREGA and maybe a flagship program for the urban sector that will generate certain income to start with, and that would generate demand for products in the MSME sector, and then only the MSMEs are likely to revive, and that might take some time to come. Thank you very much.
Thank you very much to Professor Shoikat Sinha Roy. It was indeed very illuminating. We will now have a short interactive session. I have got two names who have registered for asking questions. So first, I would like to request Poulomi Mukherjee of our college, Kaliyaganj College. He is from Bengali department. She is willing to ask question to Professor Orijita Dotto. So please, Poulomi, you unmute yourself, and Orijita, you please unmute yourself too. And rest of the speakers and audience, please mute yourself. Poulomi, can you hear me? Poulomi, আছো তুমি?
হ্যাঁ শোনা যাচ্ছে, হ্যাঁ শোনা যাচ্ছে,
হ্যাঁ শোনা যাচ্ছে।
হ্যালো,
বলো তুমি, হ্যাঁ বলো বলো।
হ্যাঁ ধন্যবাদ চন্দনদা। প্রথমে ম্যাডাম আপনাকে আন্তরিক কৃতজ্ঞতা জানাই সুন্দর উপস্থাপনার জন্য। ঠিক প্রশ্ন না, আমি একটা জিনিস জানতে চাইছি, আপনার বক্তব্যে বলবো? হ্যালো,
হ্যাঁ প্লিজ বলুন।
হ্যাঁ বলছি যে আপনি আপনার বক্তব্যে এক জায়গায় কয়েক জায়গায় দেখলাম যে ইবোলার সঙ্গে একটা তুলনা রেখেছে। ইবোলা পরবর্তী পরিস্থিতিতে দেখা যাচ্ছে যে বয়ঃসন্ধিকালীন বয়সের মেয়েরা যারা সে সময় ওই অতিমারির কারণে পড়াশুনো থেকে চলে যেতে বাধ্য হচ্ছিল, তারা আর ফিরে আসেনি। তো একটা আশঙ্কা আপনিও প্রকাশ করেছেন, আমাদেরও সবারই একটা আশঙ্কা আছে যে হয়তো এই পড়াশোনাটা তাদের, বেশিরভাগ আমাদের এখানে বিশেষ করে আমাদের কলেজেও বেশিরভাগ গ্রামের মেয়েরা পড়তে আসে, তো হয়তো তারা ঘরোয়া কাজে বা বাইরের কাছে বা জোর করে বিয়ে দেওয়া তাদের হয়তো পড়াশোনাটা আর কন্টিনিউ করা সম্ভব হতে পারে। তো ম্যাডাম এক্ষেত্রে আমার একটা জানার ইচ্ছে, আমাদের কন্যাশ্রী প্রকল্প রয়েছে বা আমাদের দেশে অন্যান্য জায়গাতেও বেটি বাঁচাও বেটি পড়াও বলে একটা প্রকল্প রয়েছে। তো ম্যাডাম এটা কি পসিবল যে হচ্ছে ওই প্রকল্পগুলোর জন্য হয়তো আমাদের এই মেয়েরা আবার পড়তে আসতেও পারে, তাদের হয়তো পড়াটা কন্টিনিউ করতেও পারে, মানে যতটা পড়া যাচ্ছে নাও হতে পারে।
আচ্ছা পৌলমী, মাইকটা মিউট করে দাও, তাহলে আনসারটা শুনতে পাবে।
আচ্ছা হ্যাঁ 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 ঠিক আছে ঠিক আছে।
আচ্ছা, আমার যেটা মনে হয়, আমি যেটা বলতে চেয়েছিলাম যে ইবোলাতে হওয়ার জন্য যেটা, কারণ আমাদের কাছে তো কোভিডে এক্স্যাক্টলি কি হচ্ছে সেটা সংক্রান্ত কোনো তথ্য বা ডেটা তো নেই, তাই জন্যে আমরা নানান ধরনের এর আগে ঘটনাগুলো কি ঘটেছে এরকম প্যান্ডেমিকের সময় সেগুলো নিয়ে আমি কয়েকটা তুলনা দিয়েছি, এবং তার মধ্যে খুব রিসেন্ট পাস্টে যেটা হয়েছে সেটা ইবোলা। এবার ইবোলাতে দেখা গেছে যে এই যে অ্যাডোলেসেন্ট বা বয়ঃসন্ধির মেয়েরা অনেকে স্কুল ছুট বা কলেজ ছুট হয়ে যাচ্ছে সেই সময়, লকডাউনের সময়, তারা কিন্তু আর ফিরে আসছে না। এবার একটা কথা বলি যে আমাদের দেশে যেমন কন্যাশ্রী বা এই ধরনের প্রকল্প রয়েছে, বেটি বাঁচাও বেটি পড়াও ইয়েস সারা ভারতবর্ষের জন্য রয়েছে, কিন্তু সেখানে আফ্রিকাতেও কিন্তু নানান ধরনের কন্ডিশনাল ক্যাশ ট্রান্সফার, এগুলো তো কন্ডিশনাল ক্যাশ ট্রান্সফার কন্যাশ্রীটা যে একটা কন্ডিশন ফুলফিল করলে তাকে এই টাকাটা দেওয়া হবে। তো এই কন্ডিশনাল ক্যাশ ট্রান্সফার কিন্তু আফ্রিকার বিভিন্ন দেশেও প্রচুর ছিল এটা, এবং ওখানেই সব থেকে বেশি কন্ডিশনাল ক্যাশ ট্রান্সফার ওখানেই সব থেকে বেশি আছে। তা সত্ত্বেও এটা হয়েছে। এবার প্রশ্ন হচ্ছে যে ভারতবর্ষের মতো দেশে, যেখানে ধরুন আমাদের রাজ্যে যেখানে কন্যাশ্রী রয়েছে, সেখানে কি এটা কিছুটা এই দলছুট হবার বা স্কুল ছুট হবার এই সম্ভাবনাটা কিছুটা কি কমিয়ে দেবে না? হ্যাঁ, কিছুটা হয়তো দেবে, কিন্তু একটা জিনিস মনে রাখতে হবে যে আমি নিজেও কন্যাশ্রী নিয়ে একটু কাজকর্ম করেছিলাম একসময়, তো সেখানেও একটা জিনিস দেখেছি যে যারা তাড়াতাড়ি যাদের বিয়ে হয়ে যাচ্ছে তাদের কিন্তু মানে খুব একটা প্রেসিং নিড থাকছে যে বাড়িতে কিছু কাজ করতে হবে, তাদের ভাই বোনেদের দেখাশুনো করতে হবে, এবং তার থেকেও হচ্ছে যে উপযুক্ত বর পাওয়া গেছে, কাজেই ম্যারেজ মার্কেটে গিয়ে তাদের একটা বিয়ে দিয়ে দেওয়া হচ্ছে। এবার যেই মাত্র স্কুল ছুট হয়ে যাওয়ার সম্ভাবনাটা থাকছে এই কারণে যে একবার যখন মেয়েরা বাড়িতে ফিরে আসছে, তারা বাড়ির কাজকর্মে তাদের লাগানো হচ্ছে, এবং কোনো কোনো ক্ষেত্রে যদি খুব পভার্টি স্ট্রিকেন হয় তাদেরকেও কাজে লাগিয়ে দেওয়া হচ্ছে, বাড়ির বাইরের কাজে তাদের লেবার ফোর্স পার্টিসিপেশনের মধ্যে দিয়ে ঢুকিয়ে দেওয়া হচ্ছে। সেখানে না মানে একটা কাইন্ড অফ একটা ইনার্শিয়া বা স্টিকিনেস হয়ে যায় তো আমাদের মতো একটা ডেভেলপিং কান্ট্রিতে। সেখানে একবার এটা হয়ে গেলে দেখবেন আমি দুবার বলেছি যে আমাদের যেগুলো খুব হার্ড আর্নড গেইন সেগুলোকে না আমরা অনেকটা হারিয়ে ফেলছি এই প্যান্ডেমিকের ফলে। কাজে এই যে একবার আমরা ওই পুরোনো জায়গাটায় ফিরে যাচ্ছি, যে মেয়েরা বাড়িতে ফিরে আসছে, তারা কাজ করতে লাগছে, তাদেরকে একটা বিয়ের জন্য একটা চিন্তা হচ্ছে, এখন তার স্কুল নেই, এখন তার মিড ডে মিল নেই, অতএব বিয়ে দিয়ে দেওয়া হোক। এইটা না একটা খুব মানে ডেঞ্জারাস ট্রেন্ড হতে পারে। আপনি এটা ঠিকই বলেছেন যে এটা কিন্তু পরবর্তীকালে ধরুন 1 বছর বাদে এটা খুব ইন্টারেস্টিং একটা স্টাডি হতে পারে যে প্যান্ডেমিকের পরেও কি কন্যাশ্রী তার এই সাফল্যটা ধরে রাখতে পারলো। মানে এটা কিন্তু একটা খুব ইন্টারেস্টিং একটা কাজ হতে পারে। এবং আপনারা যারা কলেজে ডাইরেক্টলি কন্যাশ্রী পরবর্তী এই মেয়েগুলিকে দেখছেন, তাদের হিসেব রাখছেন, আমার মনে হয় তাদের ক্ষেত্রে তারা এটা কাজটা খুব ভালো করেই একটা সুন্দর করে করতে পারেন, যে প্যান্ডেমিকের আগে এবং প্যান্ডেমিকের পরে এটা কি তাদেরকে কি ধরে রাখা গেল, এটা একটু দেখতে পারেন। তবে আমার ধারণা যে কিছুটা অল্প হলেও কিন্তু সেখানে কিন্তু সেটব্যাক হয়তো হবে।
অনেক ধন্যবাদ অরিজিতা। আমি আশা করি তোমার প্রশ্নের উত্তরে সন্তুষ্ট হয়েছে পৌলমী। আচ্ছা, আমি এবার প্রফেসর পার্থ প্রতিম পালকে প্রশ্ন করবে। প্রফেসর ডক্টর অনিন্দিতা সেনগুপ্ত, ব্যারাকপুর রাষ্ট্রগুরু সুরেন্দ্রনাথ কলেজ থেকে। আমি প্রফেসর পার্থ প্রতিম পালকে বলবো আনমিউট করতে এবং ভিজিবল হতে, এবং অনিন্দিতা সেনগুপ্তকে বলবো নিজের মাইককে আনমিউট করতে এবং ভিজিবল হতে। Anindita, please ask your question.
Yeah. Thank you, Professor Pal, for your wonderful lecture. I have actually 2 questions, but they are interrelated. My first question is that...
Just a second. Professor Parthapratim Pal, are you there?
Yeah, I'm here.
Okay.
So my question was, tourism industry is what's affected during the COVID period. So what do you think the government should do in order to rejuvenate this industry? And the related question is, do you think alternative tourism can be a tool for rejuvenation of tourism industry in the era of Atmanirbhar Bharat?
Yeah, you see, one problem in answering any of the question is that we are completely in uncharted territory, unknown territory. We have never seen a crisis like this before. We do not know when the vaccine is coming, and we do not know how effective the vaccine or the treatment is going to be. Tourism is a discretionary spending. You do not do it on a compulsory basis, on a compulsive basis. You will do only if you feel like doing it, if there is enough confidence that people should want to go out, etc., etc. So given the kind of uncertainty that is there, I have no idea how government is going to tackle this or how this is going to be tackled. I'll be very honest with you, so I do not have this answer to this question. All I know is that we are looking into a scenario which is unforeseen, unprecedented, and so far there is no cure, no vaccine in sight. These are developing, but we do not know when it is going to come, when it is going to be available to everybody, etc., etc. I guess if you ask what the government should do now, the government should, I think, start preparing the delivery of this vaccine affordably and accessibly to everybody else. That will take care of many of the problems. I can't think of anything else right now. Maybe if Shoykotdar or Orijit wants to add something, that will be fine.
Thank you, Partho. Orijita or Shoykotdar, do you want to add something with it? Because
No, I have nothing to add.
Okay.
I just add one thing. Now, tourism industry, as Parthoda said, it's a discretionary spending, and it can be only revived when the normalcy at least starts coming in. So the government actually should kind of give protection to the existing tourism sector so that they do not fall apart during this period. Because personally, if you ask me personally, and when I have discussed with my friends and relatives, everybody is geared up that whenever the next chance comes for traveling, they will do that. But it's, of course, it's a kind of a uh, trade-off between safety and personal as well as family safety, as well as with uh, the entertainment value. So during this period, I understand a lot of hotels and small restaurants and small hotel, even the hotel chains, they are closing. I do not know what can be done exactly by the government, because the government is, as it is, very pressed with financial needs. But it will recover. That's my point. What we have seen in Italy, in USA, it is recovering. The tourism industry is recovering. So that will take some time, but recover. That's my viewpoint.
ওকে, থ্যাংক ইউ অরিজিতা। আমি সমস্ত অডিয়েন্সকে জিজ্ঞেস করছি, আপনাদের যদি আর কারোর কোনো প্রশ্ন থাকে আপনারা আসতে পারেন interactive session. And also amongst the speakers, if you have any question to ask yourself, you can do it here, because we are just running short of time. We have to wind it up within 5. So please. সৈকতদা কাউকে প্রশ্ন করবেন? অরিজিতা বা পার্থ কাউকে? সৈকতদা তোমায় বলছি। সৈকতদা is not responding. Then let me proceed further. Our departmental colleague, Mr. Sandeep Sundas, Assistant Professor of Economics Department, Kaliyaganj College, he will deliver our vote of thanks just after it. So I'm just requesting Mr. Sandeep Sundas to unmute yourself and be visible.
Hello, am I audible? Chandan sir, am I audible?
Yeah, you are.
Okay.
Yeah.
Good evening to one and all. It is my immense pleasure to propose the vote of thanks on behalf of the Department of Economics, Kaliyaganj College. First of all, I would like to express my deepest gratitude to all the resource persons for sparing their time despite their busy schedule to deliver a talk on the topic post-COVID situations in Indian and West Bengal economy, challenges and remedies. Secondly, I would like to thank Dr. P.K. Das, Principal, Kaliyaganj College, for allowing us to organize this webinar. Without whose cooperation, it wouldn't have been possible. Thirdly, I would like to thank Dr. Devasis Bhaumik, IQAC Coordinator, Kaliyaganj College, for collaboratively organizing this webinar. Fourthly, I would also like to thank the faculty, non-teaching staff of Kaliyaganj College for the support, and all the participants in this webinar. Last but not the least, I would like to thank Dr. Chandan Roy, Head, Department of Economics and convener of this webinar, for coming up with an initiative to organize this webinar. I would like to wish good health to everyone. Thank you once again. Thank you.
Thank you, Sandeep. Now it's the valedictory address will be given by our. May I now ask our principal, sir, to deliver your valedictory address, sir?
Yes.
Okay, sir.
Am I audible to you?
Yes, sir. Yes, sir. Very much.
Shall I start? Hello.
Please do start, sir. Please start.
Okay. Very good afternoon to all of you. Thanks to all the eminent speakers of this 2 days international webinar for enriching us with their expertise views on the respective selected topic, with overall reflection on post-COVID situations in Indian and West Bengal economy, challenges and remedies. All the speaker professors are very big educationists and economists, and I think their views will be transmitted to the proper sectors dealing the economy of India and West Bengal, and we shall be able to combat properly against the crisis in Indian and West Bengal economy that has been created due to COVID-19 situation. Actually, I think all sectors of Indian economy are not equally affected in corona pandemic. If possible, we can segregate the sectors and provide assistance or support, whatever it be, accordingly. As for example, I think the worst hit sectors are aviation, tourism, and hospitality, where the problems started much before the lockdown. I came in late, but when I came, I found that some discussion is going on tourism. So these are the worst hit sectors due to this pandemic. Perhaps most large and medium sector industries will bounce back quickly once lockdown is totally lifted. The alarming is the small and micro sectors where businesses are owner driven will face serious challenges. The sectors that will be well placed in the coming month, I think, are pharmaceuticals, medical, agriculture, internet providers, and some online selling platforms like Google Meet, Zoom, Skype, etc. that cater the home essentials, groceries, medicines, etc. Indian pharmaceutical sector should see massive expansion, I think, with worldwide recognition and acceptance. So we may think in this way to face the problem, because the problem, nature of the problem is not known to us totally. Anyway, actually, in this pandemic, 4 legs: consumption, manufacturing, exports, and capital flow, on which the Indian economy had been growing, have all been impacted adversely. Anyway, we are optimistic and believe that we shall be able to reboot the Indian economy in post-coronavirus shock. Hope that in future also we shall get the assistance and cooperation of all the speakers of this webinar for our academic program. Again, I convey my wholehearted gratitude to all the speakers and participants for making this webinar a grand success. Okay, let me now allow to stop here with a lot of thanks to all of you.
So it's a small announcement. Our program has been closed. A small announcement. You will get your e-certificate in due time. Just fill up the feedback form. You can collect it from the YouTube link. You can collect it from the WhatsApp group link. Just collect it and submit it. You will get your e-certificate in due time. Thank you. Thanks to everybody.
চন্দন ক্লোজ তো? হ্যালো চন্দন, চন্দন আছো? হ্যালো
Namaskar. The process of COVID-19 unlock has already begun. During this time, you should step out of your home only if it is necessary. While putting on your face cover or mask,